A third case of coronavirus, the patient being treated here at a specialist unit inside St Thomas's Hospital in London. It's no surprise the virus is fast spreading and more cases here in the UK were expected. But this time there is a significant development.
They acquired it in Asia but not in China. And at the moment the great majority of the cases in the world are still in China, the great majority. There are a few in other countries. And our view is, because of that, it's probably now prudent to slightly widen the geographical area where, firstly, doctors in the UK and the NHS know that they should test people.
The patient's identity is being closely protected. We know very little about exactly where and how they came into contact with the virus. But we do know one thing, that there's no connection between this latest case and the other two known cases. A student from York University and a family member were identified last week after staying at this hotel. They are known to have contracted the virus in China. Now the advice to NHS doctors and all frontline staff will have to be updated. In the past, they've only had to worry about people who have travelled from Wuhan in China or who have been in contact with people who have travelled to that region. Now they'll have a much wider geographical region to deal with. That list now includes China, Thailand, Japan, the Republic of Korea, Hong Kong, Taiwan, Singapore, Malaysia and Macau. The Chinese are sensitive to criticism, accusations that they're withholding information or are downplaying the number of infected and dead. China's ambassador to Britain urged Western countries to stop creating unnecessary panic.
It is our hope that the governments of all countries, including the UK, should understand and support China's efforts, respect the professional advice of WHO.
China is sharing more information than it did during the deadly 2003 SARS outbreak. But it's not officially confirming the death of Dr. Li Wenliang, who was one of the first to warn of the dangers of this outbreak at the end of December. He was silenced by authorities and forced to return to work, where he caught the virus from a patient. His death adding to the number of fatalities rising daily.
We don't know the source of the outbreak. We don't know what its natural reservoir is, and we don't properly understand its transmissibility or severity. To defeat this outbreak, we need answers to all those questions.
We are learning more about the virus, but much remains unknown. Pictures like this of medics in hazmat suits taking away a patient suspected of having coronavirus in York will do little to ease nerves in the city and elsewhere. The patient later tested negative. But the government is stressing once again that its plans are robust and the country is fully prepared to deal with this epidemic. Ashish Joshi, Sky News.